in order to diagnose an individual with ADHD, a child or an adult with ADHD, there needs to be a proper assessment. What do I mean by a proper assessment? All the components that were mentioned before in terms of executive function needs to be tested. Notice I didn't say screen, I say tested. We need to administer tests to test for working memory. We need to administer tests that will test for emotional regulation, cognitive flexibility. We need to test for these areas. In other words, we need to administer tests that look specifically at executive function, because fundamentally ADHD is an executive function disorder. We also need to do thorough historical data collection of the development of this individual, all aspects of development, psychiatric development and physical development. And with that thorough background of this individual and with the results of tests for executive function, we can use that information with the clinical interview that a good registered psychologist who's trained in this area will do. With all of that information, we can now look and determine if an individual fit the diagnostic criteria for ADHD.